thank you very much for joining. This is what we'll be going through today. And so we look forward to talking with our speakers, Dr. Femi Omololu, who is the MD and CEO of Lagos Island Maternity Hospital, Dr. Ugo Okoli, who is the Deputy Country Director for JAPEGO, Tolu the Midwife, who is an award-winning midwife and convener of Tolu the Midwife, that's Tolu Adeleke Ere, and also Nurse Ko Adebukola Oluwabusayo, who is the Apex nurse at Lagos Island Maternity Hospital. So we're going to be speaking to them today all through the webinar, and hopefully at the end of the webinar, we would have created a clear path for us to get involved in catalyzing accountability for maternal deaths, not just in Lagos State, in Nigeria and in the world generally. So let's get to it quickly. I'll just give a brief lowdown now about the Giving Birth in Nigeria project. So what is the Giving Birth in Nigeria project? The Giving Birth in Nigeria project was launched as an 18-month project in January 2019, when 3 organizations came together as a consortium. HEATHCARE, Nigeria Health Watch, and EpiAfric came together through the support and funding from MSD for Mothers, MSD's global initiative, to help create a world where no woman dies while giving life. And the mandate indeed, and the mandate and achievements of this project so far in the last year and a half where we've been operating is basically for us to increase awareness of maternal mortality in Nigeria, and generally speaking, and also particularly in our 6 target states of Lagos, Bayelsa, Bauchi, Kebbi, Ebonyi, and Niger states, as well as the FCT. And over the last year and a half that we've been working, we have achieved this through increased media engagement in maternal health and also maternal mortality stories, and the multi-stakeholder meetings where we've involved public office holders, community leaders, religious leaders, healthcare workers, healthcare professionals, and the women themselves coming together to talk about the challenges they currently face in seeking maternal care, seeking better maternal care, and also how they can chart a way forward. So we've had these multi-stakeholder meetings in all these other target states, and Lagos State is our last state. And gladly, we're doing Lagos State online here, and we're very happy to have all of you here talking about this. And also, in addition to that, looking forward, we are looking to ensure that there is better quality maternal care at all levels, so that women in these local communities and in these states and indeed Nigeria no longer die while giving life. And at the end of it all, at the end of the 18-month project, the Why Are Women Dying report, which will show the results from our inquiry, our year-long inquiry into maternal deaths in these selected communities, is scheduled to launch mid-2020 with a global release of our findings. And we are grateful to MSD for Mothers for their support as we collectively chart a future where no woman dies while giving life. So this is basically the essence of why we're here. We want to talk about current challenges we face women face in seeking better quality maternal care in Lagos State and in Nigeria as a whole, because we have people from outside Lagos here also looking to chart a better future for women. So having said that, I think I'll hand over to Iyaduni Olubode, the Nigeria Director for MSD for Mothers, to talk about MSD for Mothers in Nigeria and their goal of ending maternal mortality. So Iyaduni, over to you.
Thank you so much, Bumi. Good afternoon, distinguished speakers. Good afternoon, everyone who has signed on and is present for this webinar. I'm excited to be here and to be in a conversation about maternal health. I love maternal health conversations because what that means is at least one more person is aware of the, or has a deeper understanding of the issues, and hopefully is able to advocate for women wherever you sit. Now, according to WHO, 67,000 women die annually in Nigeria from pregnancy or childbirth. And what that means is that a quarter of the women who die in the world, or nearly a quarter of the women who die, are Nigerian. Contrary to what we've become accustomed to thinking, it is not normal and it is not the will of God. These deaths, most of them, they're preventable. And this is why MSD for Mothers established the initiative. This is why MSD established the initiative. Now, MSD is an American pharmaceutical company. In America and Canada, we're known as Merck, but in Nigeria, we're known as MSD. And the MSD initiative is an initiative that aims to address maternal health by mobilizing resources. And the ultimate objective is to help to create a world where no woman has to die giving life, because we know that these deaths are preventable. It is really an initiative that represents a private sector commitment to the Sustainable Development Goals, and specifically Goal 3.1. And that's the SDG goal that speaks to maternal health. It aims to reduce maternal health to less than 70,000. Hear this, less than 70 deaths per 100,000 live births. According to the Nigerian DHS, I'm sorry, I don't remember the acronym for that, but the NDHS report, which is a survey that is done about every 3 years, it says that our current maternal mortality, according to that report, is just over 500 deaths per 100,000 live deaths. So the target is 70, less than 70 actually, by 2030. And currently, we're at 500 per 100,000 live deaths. And we have 10 years to go. So it is a huge challenge, but it's not insurmountable. The change is very possible. You know, the solutions are not complex. We need two things. We need to focus and we need collective action. When a woman dies, we know that it significantly reduces the survival likelihood of her baby. We know that if she has older children, it's less likely that those children will continue to go to school. We also know that it means that her household suffers economically. Now, it's not just her household that is suffering. It is the whole nation that is suffering. I want you to imagine 67,000 Nigerian women, the economic impact of 67,000 Nigerian women. And that's what we're losing every year because of this maternal health problem. So it's not just sentiment, it makes economic sense to invest in maternal health. And many times when we think about maternal health, we think that it's a government responsibility, but we need to realize that we are all stakeholders. The women are stakeholders, the men who live with these women, who feel the pressure of our absence if we pass away from pregnancy. We're all stakeholders. The communities we live in, the communities we serve, you are also stakeholders. The healthcare workers who look after us, we are stakeholders. So this business is everybody's business. We're here today to, chat a talk, a cause and to drive for accountability, to understand what those challenges are, and more importantly, to seek solutions. As stakeholders, we need to be aware of this responsibility and we need to live up to it in today's conversation and outside of today's conversation. I want to wish the speakers all the very best, and I want to invite you as a stakeholder to bring your best to this conversation. Thank you very much.
Thank you very much, Yadini. Thank you very much. We're forever grateful to MSD for Mothers for this opportunity to throw a light on the issues of maternal mortality in Nigeria. It's not just something for one section of the country to think about. It's a collective effort. Everyone must be involved in making sure that that woman beside your shop, that woman who is your neighbor, who is pregnant, does not have to die while giving life. She has the right to live, and everyone should realize that collective responsibility. And that is the essence of catalyzing accountability for maternal deaths in Nigeria. It's not just some big word. Everyone has to know that they have accountability to an extent to the survival of a woman while giving life. So quickly, shortly before we start with the discussions of today, we'll just quickly do a quick poll, a quick maternal health trivia for everyone. So it should be on your screen anytime soon. Yes, so everyone just quickly answer these 3 questions. So make sure you scroll down to the 3rd question. You have 3 questions there. Hosts and panelists cannot vote, unfortunately. So our dear participants, I'll just give you less than a minute to look through the questions. And at the end of the webinar, we'll be releasing the answers for everyone to see. This is just to test your maternal health in Nigeria knowledge. Nigeria accounts for what share of global maternal deaths? What percentage of women in Nigeria give birth with a skilled attendant? And how many delays are associated with maternal mortality? Okay, so moving on, I guess we can dive into the first discussion of today. The first panel discussion of today will just be talking about the needs of women seeking maternal care, and also the role of health education and community empowerment, as well as the role of health facilities in ensuring that women get the adequate care they need. So we've seen in our recent research where we've spoken to women in our target communities throughout the course of the Giving Birth in Nigeria project. And they talk about a lack of health education. They talk about the fact that, I get this information from my religious leader. I get this information from my traditional leader. But we've realized that these people just get information that is not backed by science, that is not backed by health facts, just religious words, things that they see in their religious books, and just assume this is okay for women to do, this is okay for us to do. But these women are misinformed. And also, talking about healthcare facilities, they are in these communities, they lack access to healthcare facilities. Whether you're talking about access from their homes, whether you're talking about being able to actually transport themselves to these health facilities. So the question now is, what, from your experience on the field, from your experience as a healthcare worker, from your experience as a midwife, as a nurse, what has been your experience with these women? What do you think are their needs while seeking maternal health care? And also, what do you think is the role of health education, health facilities, and community empowerment in ensuring that they get the adequate care they need? So I'll start with Dr. Ugo Okoli. What are your opinions on this, and what do you think women need?
Okay, thank you, Bumi. I'll just digress a little bit, but I'll keep to my time. I lead a project called the RICOM project, and our overall goal is actually reducing indirect causes of maternal mortality and morbidity associated with preeclampsia and eclampsia along the maternal health continuum. And this focuses on prevention and management of hypertension, diabetes, anemia, and obesity, which is actually very, very important. This project is funded by MSD for Mothers, and we're in a consortium of partners implementing it, the JAPIGO, MDOC, and Health Strategy Delivery Foundation. I'll just share a few things that we did at the initial period. We did a survey we actually work in Lagos and FCT. We did a survey of 300 women in 2 local governments in Lagos. And out of those 300 women, we offered those that consented, about 200 of them, a point of care test for these conditions that I listed before. And the results were quite outstanding. And I'll just list some of them. We had 28% of these women at stage 1 and 2 of hypertension. And 51% were actually obese. And overall, 51% had 3 to 5 risk factors for preeclampsia and eclampsia and cardiovascular disease. But you know, the most significant finding was that less than 5 of them were aware that they actually had these problems. They didn't know their status until that day. So you cannot even begin to underestimate the sort of health education women need in every community, not just in Lagos. And then also to actually improve their health-seeking behavior. You know, women usually, you know, just go about their business, trying to put food on the table for their family, and not basically caring for themselves because they either don't have the money or they don't actually have the access to those health facilities. So my own suggestion is that we need this health education at every point of care, at every opportunity we have. From community, just like Iyaduni said at the beginning, from the community level at different touch points, churches, religious leaders, the media, associations, and NGOs, down to the healthcare facilities. I know you did say at the beginning that most of these people might not have the evidence or the correct information behind it. So it's how do we galvanize ourselves to ensure that women actually, or these organizations actually have the correct information. And I believe this is where we don't leave it to government alone. In Lagos State, I know we have health educators at the local area, and those people have the correct information to give women. But not every woman has the opportunity to actually access them. Women also are able to access health facilities and get the correct information because the nurses are trained and the people that they see, we presume that they are well trained. However, what is the local role? What is the role of the NGOs? You know, the local NGOs that we have. I believe they have a role in ensuring that these different organizations actually have the correct information. And then also private sector. I believe that private sector has a role here where they can actually fund and support organizations to provide this accurate information that will reach women. Because we can't wait for them to just be coming to the health facilities to get it. We have to use the opportunity at every point where we meet them along the continuum of care, including the community.
Thank you very much, Dr. Okoli. Thank you very much for that. So quickly, I'll just head to Dr. Omololu. So as your experience as the MD of Lagos Island Maternity Hospital, what has been your experience with women and their health-seeking behaviors, talking about health education and empowering them from the community level into the health facilities?
First of all, I want to thank you for the opportunity to be a part of this very interesting presentation and very relevant presentation. Talking about what pregnant women want, I think every pregnant woman first and foremost just wants to have a baby. She wants to go through a safe pregnancy and to, you know, come out of it well at the end of the day and carry her baby in her arms. But that process, you know, there are a lot of things that go on within that process. And what are the things within that process? She needs access. You know, where is she going to go? Somewhere that is close by, somewhere she can easily get to, you know, to get, and where she can have affordable health care or something that will give her value for service, because that is also important. It's not just a matter of going anywhere. They may want to go to one of the best hospitals, but they may not be able to afford it. So they want to go somewhere where they can get value for what they are going to get. In our experience here, we also see that women want timeliness. We live in Lagos. Transportation is a very big issue. Traffic is a very big issue. So people want somewhere where they can easily go to. And as women are getting more empowered, because women we see here in Island Maternity cut across almost all the different social strata in terms of socioeconomic status. So some of them are working mothers. When people are there, they have professional jobs. They have their own businesses. They work in the markets. So they want timeliness. They want a place where they can come to have you know, have the antenatal care services promptly so that they can also go back to work and go back to what it is they are doing. Especially those who are, even the housewives want to go back to picking their children on time. They also want information. When the woman is pregnant, there are so many doctors for her. And I say doctors in inverted commas because the mother becomes a doctor, the friend becomes a doctor, the colleagues at work become a doctor, and everybody is basically giving this woman advice on, you know, what to do. So she needs to get the right information, which is key. Like Dr. Okoli just said now, some of the men don't even know, they don't even have any information at all. They just know they are pregnant. I mean, some of them, their mother gave birth, you know, in a TBA home, and therefore they feel, well, I just go to the same TBA, and they may not really get all the information they need in depending on the type of facility they go to. I think everybody wants safety. They want to be safe. They want to know that the doctors and the healthcare providers are going to know what they are doing. They also tend to want some consistency. I mean, when they come to the hospital here, they may want to see the same doctor all the time, so that there's some kind of familiarity and they feel comfortable talking to that particular doctor. But unfortunately, that's not always possible within our environment. Within the scope of the practice we have here, being a large and secondary healthcare facility. And then they also want quality. Quality is very important. I mean, they want the place where they feel comfortable, where they are being seen, while they are waiting to see the doctor. And they want the right attitude coming towards them from the healthcare providers that are going to see them. So these are things that are very, important to the women. And what's the role of us, the provider, in providing these things for them? We need to have the right knowledge and skills. We can't give what you don't have. If you don't have it, you can't give it, So we need to continue updating ourselves, getting the right knowledge and skills so that we can translate these things back to our patients. We need to be able to track patients' care. I don't know if you can see me. Lagos State government used to have this booklet, which we used to give to women at the primary healthcare centers, so that when they come to the secondary facilities, it's easy for us to track their care. And then, that way there's no gap, because when a woman comes in an emergency situation, it could be difficult to actually know exactly what is happening to her, what has happened to her before, and never enough time to get all the history. I will need to be sensitive to patients' needs and concerns. So it needs to be a two-way communication. We need to engage the women, find out what it is they want to know, find out what it is they know. And consultation needs to go beyond, just the medical side of it, because there is a social aspect to taking care of people. Adherence to protocols and guidelines for care, very critical for us here in the secondary healthcare facilities, because that's what will lead to quality of care and also help to prevent maternal mortality. So that will come up later on.
All right, thank you very much, Dr. Omololu.
And I believe generally there should be facilities for comprehensive obstetric care, which will make sure the men get the right type of care that they need. Thank you.
Thank you, Dr. Omololu, for that. So Nurse Cole, the Apex Nurse of Lagos Island Maternity Hospital. So from your experience, you work directly with these women. You work with them on a daily basis, working with these women who come for antenatal, these women who come at the point of delivery and also after delivery. So what has been in a nutshell, what has been your experience with them, with their needs in particular, particularly relating to giving birth?
Thank you so much, and I appreciate you for the opportunity. I want to say thank you too to my MD for the connection. Yes, my experience has been that in the way I worked, most especially to those that come on time to book in our facility, we don't have issues with them. But there are some people that, despite that they know they don't come on time because of lack of education, as Dr. Okoli has said. Majority of them, they believe that they can stay true. They believe that since what their parents have gone through, they too, they can go through that. So all we all need to do is just to intensify on our health education. And I believe that it's everybody's effort. It's a stakeholder's effort, both the husband, the wife, the parents, and everybody. We just have to go in depth to our community, churches, mosques, to educate them, to let them know the importance of safe delivery, to let them know that assessing and a facility, an healthcare facility, is very important to them to save their lives. Thank you.
Thank you very much, Nurse Cole. Tolu Adeleke Ere, can we hear from you? Tolu, are you there?
Muted.
Sorry, I was on mute.
Yeah.
Good afternoon, everyone. Thank you for this amazing opportunity to talk about what I'm very passionate about. So I feel with women who are seeking care, especially first-time mothers, don't actually know. They want, like Dr. Omololu said, they want to deliver their baby safely, but they don't know what they don't know, in the sense of they want to know everything about what to happen while they're pregnant. They want to know what they should be doing and when. And even though we say health education, it's a bit more than health education. So as a midwife, it's providing holistic care, and that's providing emotional support, physical support. We can't isolate just the pregnancy and think we're looking after this woman just because she's pregnant. We have to think about her social status or her social settings, social environment, because it will affect her how healthy she is in pregnancy, which will also affect the baby, which also affect the baby's outcomes later on as this child grows up. So it's a holistic approach to caring for this woman. And then also, as healthcare providers, I guess we're also empowering her to take care of herself in the pregnancy as well, to I guess empowering her, to telling her what she needs to know as she's going through the pregnancy. The role of health education is, I don't think we can say it enough, at every single level, like everyone has said already. And then it's also devising a system that we ensure that the information we are giving to the women, they actually understand it. Because women will tell you they go for antenatal, yet they still don't know when there's deviations from the norm, or they don't know when they're having signs of preeclampsia. They don't know that a persistent headache, for example, is not normal, but they've attended antenatal. So I feel in delivering our health education, we need to be a bit more thorough. We need to go through, whether it's, I run private antenatal classes, and I run it in smaller groups, because then I can pinpoint women who are not really engaging with me. And I understand the system. I understand that there's a lot of women, so you can't really afford to have smaller groups. But we need to find a way to make sure that the women are understanding the information we are passing across during this during the health education classes or antenatal classes, whether it's in the hospital, in the primary healthcare centers, in my classes. We just need to make sure. I think that's one of the only ways we can actually reduce maternal and neonatal mortality. And I find that women who are educated, and research shows us, women who are educated make better decisions for themselves and for their babies, and also have a better and favorable outcome. So the gap of health education and the different levels of health education, I think we could work a lot better on or at, to make sure women understand the information we're giving, using working together, partnerships, working with all the local influencers, as it's already been said several times during this conversation. Thank you.
Thank you very much, Tolu, for that. So as we all heard, the crucial thing is we have the position or the power, should I say, to actually help these women, the healthcare workers, those in the health facilities, the policymakers. We should actually ensure that we visit these women at their points of need. So we have to go down to their level so that we can lift them up, for them to even know what they need at the end of the day. Some of them don't even know what exactly it is that they need. So how would they seek for healthcare when they don't know the healthcare that they should actually ask for? So we thank the panelists, the speakers, for that. We'll just quickly go to the next panel discussion, because we're trying to run through this. We can see your questions at the end of the entire webinar. We're going to attend to the questions, and each panelist is going to answer the questions. And when you're asking your questions, mention the particular speaker who you want to answer the question. And if it's a general question, that's fine, just ask a question. And if there's a question you've asked that has been asked that you had wanted to ask, just like the question, so that it can bump up to the top of the page and we can ask that question. So the coronavirus pandemic, we've seen reports that skilled birth attendance has fallen. For example, the Minister of Health announced that skilled birth attendance actually fell from about 158,000 to less than 99,000, and immunization has fallen by 50%. So obviously, the impact of the pandemic has been widespread. Everyone feels the impact of the pandemic, but particularly for maternal health care delivery, particularly for pregnant women who may want to go for their antenatal visits, who may want to go and actually give birth, who may want to go for other treatments, even maybe after they have given birth. So in the light of the current COVID-19 pandemic, its impact on maternal health care delivery, supply, and demand in Lagos State, what do you think we should do? What do you think the government of Lagos State should do about this? What do you think should be the next step forward? Talking about coronavirus, the coronavirus pandemic, women seeking healthcare, and the future post-coronavirus. So with this, I guess I'll start with Nurse Cole.
Yeah, thank you again. The pandemic has brought a lot of changes into the society. Like in the facility where I work in Lagos Island Maternity, it has not affected us at all because we have increase in our deliveries. And I want to seize this opportunity to say thank you to Lagos State government that has made delivery, antenatal, and everything free. Because we have a surge in the month of April, even through month of May, of people coming out to come and deliver. And we're encouraging other people too that are listening to us that the hospital is open, they can come and deliver their babies safely. Then the government can still help us. We need personnel. We need a lot of things to work with because this has taught us a lesson that we should improve in our facilities, in the way we attend to our patients. Telemedicine, telenursing, and so on can be very effective in attending to patients. And this one taught us too, during the lockdown in Lagos Island Maternity, our online antenatal was going on. So our patients did not miss at all. Health education, what they need to know in depth were taught during the period of lockdown. And even presently now in the facility, ANC is going on and we observe what we call the social distancing according to the NCDC. So there's no problem about that. Then we need personnel, we need equipment, we need modern things to work with. And we are trusting government for their supply so that it will make everything to go on smoothly. Thank you.
Thank you. Tolu? Yeah.
Sorry.
Yeah.
Sorry, go on.
Go ahead, Tolu.
So with the coronavirus, I think because we were all learning at the same time, we're all learning about it in real time. From the clients I have for antenatal, I've noticed that a lot of them were given, and this was for both the private and public sectors, their antenatal appointments were spaced out. So some, like I had a lady at 28 weeks and she said that they said she should be seen at 6 weeks. And I guess it's because it was new to everybody and we didn't know how to address it. Okay, so basically it was that a lot of women have had their antenatal appointments spaced out. I only do antenatal education, so antenatal education, postnatal support. I'm not actually clinical, so I noticed that, well, what the feedback was that a lot of their antenatal appointments had been spaced out. And because once again, women don't know that there's only so much, regardless of what's happening in the country, you still need to have antenatal checkups. It was just empowering them and saying you have to be sometimes a little bit forceful to have antenatal checkups. And then in terms of like speaking with some of the private hospitals, I don't really do have any of the state-owned hospitals in Lagos. It's how can we make this possible for the women to still have antenatal checkups or antenatal appointments that works for the hospital and that works for the women. And there's a really great hospital in Lagos, and they devised everything, like in terms of their social distancing, spacing out appointments. There was one that was going to implement something that I'd seen on social media in terms of you have a telemedicine consultation in the mornings, and they discuss all your antenatal as you would do in the pregnancy, and then you have a drive-through in the afternoon and they listen into the baby and do your blood pressure and do the vitals, things they can't do over telemedicine. So it affected a lot of women that way. But once again, just empowering women, educating them that you do need to be seen, go to your hospitals, call your hospitals. It's not a time to shy away from the hospital, take all the necessary precautions, but you still need to go to the hospital. You still need to have your booking appointment. You still need to register, have a booking appointment when you're supposed to have it. The COVID can't stop that. So that was my encounter from my clients.
Thank you. Dr. Omelolu, in your place as the MD of the Lagos Island Maternity Hospital, so what do you think has been the challenges with women seeking care during the pandemic, and what do you think should be in place for these women?
Sorry, the pandemic, it's a new way of life, and we found ourselves having to constantly make adjustments, concerning the pandemic. During the lockdown, it was a bit tricky, especially with having women to come for antenatal because there's no access to movement. Thankfully, like from schools and Lagos State government, provided health for women. So that's where a lot of women came in. In fact, we had an ups in our deliveries in that month, and we were able to, provide for all the women that came, and they even had it. They had free deliveries, and that was good to see. But thankfully, pregnancy, COVID-19 hasn't been found to affect pregnancy itself, and that's something that has been that we are happy for. What we've had to do when we had to open up the clinics after the lockdown was to come up with measures that will ensure. The major challenge has been with distance, because we want to protect patients, we want to protect the health worker. For instance, you have a lot of asymptomatic settings, create social distance engineering. That means processes by which women and the distances is maintained. Patients are wearing face masks before they come to the hospitals at all times, trying to reduce the number of patients that come into the hospital. And this is just to pick some of the measures that we've tried to take to ensure that within the Lagos Island maternity. Just like has been said by the last speaker, we've had to increase the interval of clinic visits. This is not new, actually. The WHO actually has what we call the focused antenatal care model, whereby low-risk patients are seen, just maybe about 4 or 5 times throughout the whole of their pregnancy. So we've had to do a risk assessment of our patients, and those who are low risk are given longer appointments. And use of technology, we've tried to do that now, because we now have telephone lines whereby people could call in and discuss with their doctors before their next clinic appointment, especially now that the next clinic appointment is really quite long. So we opened on 4 new phone lines for that, so that women be able to access that. Like Major John Cole said, we also had the ongoing antenatal classes going on during the lockdown, and that continues still. That interaction, because it's a new way of thinking, and we just have to, adapt to it. In terms of patient safety within the hospital, and also safety for the doctors, we have the challenge of when women come in labor, we want to mask them, but then, pants and all that in labor, it's been a bit tricky. We've had to look at the ventilation in our labor ward, the airflow and all that, to try and prevent risk of spread. We've also had to increase the use of our PPEs, that's personal protective equipment, in our labor wards, so that we are keeping ourselves safe and also keeping the patient safe. Fortunately, we've not really had to deal with any COVID positive woman here in Island Maternity, because we are not really expected to isolate and send them to the isolation center. We've had to do, I know I was involved with the case that happened in Bagada Isolation Center, where woman actually had a cesarean section then, and we have to come up with new protocols for delivery, and for cesarean section, because it's a whole new ball game, and it's not something they're just doing the way you normally do. So COVID-19 has changed the scope a bit, but women can still access, they can still get their care, and the issue of information, health education, which is more relevant now. Now there's not so much time for, even in the hospitals, the health talks are not going as much as they should go. So there's a need to carry, through other means. And technology has a big role to play in that. State government needs to do more jingles A lot of people are on WhatsApp now, need to come up with WhatsApp videos which are telling them the different things that they need to know. And we just have to be innovative in our thinking and how we need to, and in terms of what exactly we want to achieve in terms of getting information to these women so that they can have safe and healthy deliveries.
Thank you. Thank you. Dr. Okoli, so I'll ask, particularly referencing your experience with the RECOM project and knowing fully well that that's about quality of care, points of care. So with this experience, what do you think will be the impact of this pandemic on women actually seeking care at this point?
Okay. I would like to just start by saying that COVID-19 pandemic has no doubt threatened to undo the kind of hard-aimed health gains we've made in the country, in gradually building our health systems. The way it feels now, I know we have to tackle COVID-19, but somehow it feels that we are somewhat neglecting our routine and essential services, especially maternal health care. How I wish every hospital was like island maternity. But during that period of lockdown, there was a lot of deferred ANC, deferred PNC, deferred family planning appointments and immunizations as well. Not to talk about disruption of even supply chains of commodities and consumables. And of course, women were so anxious and concerned about actually going to the facilities because they didn't know which facilities actually had the full services in place or were actually providing skeletal services. And above all, even to get the transport to actually get to those facilities. I'll give you an example of the facilities that RICOM 3 project supports in Lagos. We looked at the February data and the March data, and you could see a major difference just under 1 month. We had a 45% decrease in the number of women registering for ANC1 in those facilities in Lagos. We had a 9% decrease in total number of ANC attendances. We had a 14% decrease of women accessing contraceptive, modern contraceptive methods in those facilities. So as you can see, these will have medium to long-term impact on these women. But as we go forward post COVID-19, what I would say is that for a state as a whole, or even for the country, that we need to begin to put a plan in place that enables us to be prepared and resilient to these sort of shocks, such as COVID-19, so that we are able to avoid the disruption of provision of routine and essential services for maternal health care. I will suggest 3 components, and Dr. Omololu and Nosco have actually touched on them as well. 3 components that we should start looking at, because during this pandemic, we found out that there are different methods that we can actually use to reach out to women. Dr. Omololu has actually mentioned some of them are meeting them, actually providing for them remotely, doing online ANC attendances, which RICOM project also did. So we know we can reach a lot of women through phone calls, through phone messages, through WhatsApp groups, and be able to actually provide those virtual ANC, virtual family planning, and virtual PNC, preparing them for birth and preparing them for complication readiness. We know we can provide self-care. We can support them for self-care as well. We know that we can set up helplines. I mean, Island Maternity has shown that example. I don't know why most general hospitals cannot have dedicated helplines manned for pregnant women so that they can reach the hospitals they want to reach outside hours, even within hours, like during those lockdown, those that actually had very big needs. However, we just cannot rely on remote and virtual initiatives because we know we have huge health inequalities in the country. So we have to find a way of also adding the community component where we actually have health educators. We can also adopt the government initiative, the federal government initiative called CHIPS, the Community Health Influencers and Promoters of Service. I'm sure Lagos can actually think about this to complement their health educators. These people can actually visit the pregnant women at home, advise them on common discomforts, provide even drugs, iron folate, malaria drugs, ARV, and so on and so forth. And they even begin to even triage and screen women and then identify those that actually need the hospital to attend the hospital. And then, of course, the last point of care is the health facilities. I think Dr. Monolu has actually excellently described what every hospital should actually be doing at the health facility. I think in order to actually give the women the confidence to come back within this COVID period and post-COVID period, those sort of initiatives such as ensuring infection prevention control, both for healthcare workers and for the women themselves, and then also ensuring this physical spacing, especially in the antenatal unit, and then also in the labor unit, is very, very crucial. And of course, above all, is to keep showing that respect and changing our attitudes towards women so we can encourage them to actually use those facilities. Thank you, Guru.
I've heard from the different panelists. So I just want to know, still on you, Dr. Ugo. So I just want to know, based on your own experience now, and looking at the whole picture, like looking at the entire maternal health delivery picture as a whole, what do you think? Because now you are talking about the health facilities, you're talking about the women at their points of care, at their points of need. But what do you think should be the role of, we're talking about the community, the community leaders, the religious leaders, the healthcare workers too, that are also helping the women in the health facilities, the husbands, even the husbands and the women themselves. How do they play a role in all of this? Like, what do you think should be their role in all of this? Because these are the different stakeholders that we're talking about.
Yeah. So, you know, like everybody has said on the panel, you know, people at every opportunity should actually be aware how they can help, you know, pregnant women that are seeking their help. So, for instance, in the health facilities, I think we've outlined that all here. You know, the nurses know what they have to do, the doctors know what they have to do, they receive the training, and, you know, again, I keep saying about the respect and attitude towards healthcare work and towards the women, so that they keep coming to use the facilities. And in the community, we know that we have so many touch points in the community where women can receive these services, but it's about having proper coordination, proper information to those people that you've mentioned, religious leaders, market women, associations. And that's why I keep calling on NGOs. There are local NGOs that actually work within the community. How do we ensure that we coordinate this and that we actually give the right messages to these organizations as well? I know in Lagos State, for instance, they have a Lagos State Traditional Medicine Board, where, you know, healers, traditional birth attendants, and so on and so forth are registered. And this board actually has an important role in terms of also training, because most of these people that are registered with them are in the community, and women go to them as well. So it's about providing the right information to these women through this sort of board that I'm talking about. And then, of course, Lagos State, I know that the Department of Family Health and Nutrition, they also work with health educators that I've talked about before. These health educators can also be providing the right information in the community, but you can never do enough from the government side, like I always say. You just have to involve other people, not such as local NGOs. There's a lot of people online looking at the participants list, actually work with NGOs. You know, they all have a role to play. The private sector also has a role to play to ensure that people have the right information and meeting the women at their point of need.
Thank you very much, Dr. Okoli, for that. So I guess we can now move on to our final panel discussion, which is just talking about the future, charting the way for the future. So, because everyone's saying this is the new normal, we should get ready for the new normal. The world is not as we knew it before coronavirus. So looking post-COVID-19, what strategies and what plans do you think should be in place to make sure that in this new dispensation, no woman dies while giving life? In this new dispensation, there are actually processes and systems that are put in place to make sure that no woman, you know, goes through hardship just because she wants to give birth. So we are also talking about putting safety measures in place. For example, a woman who is pregnant cannot go to the hospital. Cannot go to the hospital, and one way or the other ends up getting the virus. So what measures should be put in place both at the private sector, at the facility level, in the community, at the community level, and also talking about policymakers. From your own experiences, what measures, what plans, and what strategies do you think should be put in place, looking at the post-COVID-19 Lagos states, post-COVID-19 Nigeria, and indeed the post-COVID-19 world? So I guess I'll start with Tolu. I'll start with Tolu on that. So you're talking about your direct relationships with these women. You're a midwife. You're always with these women. What do you think should be put in place for them?
I think in order to truly implement change, it takes like I keep saying, it's a holistic process. It's a multidisciplinary approach. And by that, I mean, just as a midwife or just as an obstetrician, say, we can't do the jobs on our own. We need, it's teamwork, and we need different arms of the team. I think going forward, we need to think about, if we're thinking about truly reducing maternal and neonatal mortality, we need to think about, we're trying to empower the women. So why don't women carry their handheld notes? Because we know in Nigeria, for example, in Lagos, somebody might live in the outskirts, like say Egbeda, far in the outskirts of Lagos, but work on the island, Lagos Island, and she's pregnant, just as an example. And at 28 weeks, she might start bleeding. She goes to a state hospital on the island. And then she doesn't know her notes, you don't know the placental position, you don't know her history. But if she's carrying around her handheld notes, she's empowered because she's looking through her notes and she's seeing when there's a drastic, when there's a change in different things like blood pressure, so forth. And then the healthcare practitioners that's attending to her in that emergency also know her history. Also, the World Health Organization does say that women should carry their handheld notes. So in the new Nigeria, I think I would love if we can all if women could carry the post-COVID maternal services in Nigeria, if women can carry their handheld notes. And then in terms of, let's look at staff and accountability, and I'm a midwife, so I'm not knocking anybody, but I feel if we have a maternity information management software, and I know there's already some in place, but if we have a maternity information software and a woman comes into the hospital and certain values or her blood pressure or something is slightly abnormal, or we notice that her weight is going up as she's going through the pregnancy, and obviously that has its own implications, the system won't allow the nurse or the midwife or the doctor to override it without making a plan to follow up or referring her to a dietitian and so forth. One, it's holding us as healthcare practitioners accountable, and two, it's ensuring that we're giving the right information to the woman to prevent the woman from developing complications later on in the pregnancy. This is just some of the things I'd like to see in the new Nigeria. And then another thing, we're trying to get across health education, because if women are empowered and educated, they will change their health habits. So let's meet women where they are. I think you said it right at the beginning, Bumi. Let's meet women where they are in terms of delivering this information in the way people want to digest it, or want to take, or want to, basically want to digest it, right? What do people do? Regardless whether there's no money or there's money in the country, people watch YouTube, people watch things on their phone. How about we deliver the information in a sitcom on YouTube? We mask it as entertainment, but it's actually really educational. And then they will start spreading the news amongst each other that actually this is not normal. I saw this thing on YouTube, because people tend to believe a lot of things that they see online on YouTube, on the WhatsApp groups and so forth. So why don't we meet them at the point of their needs, or meet them at the level they're on, and educate them in that way to change their health behaviors. And then also we're talking about, we know the reasons why women are dying. So we know that some women don't want to come into the hospitals, but why? And I think Dr. Okoli mentioned it very, one of her answers. Women don't want to go to the hospital because we don't trust the nurses, we trust doctors, but we don't really like nurses and midwives, and we don't trust them, or we don't like them because of attitudes, because of so forth, because of things like that. So how about we look at the nurses, and if there's a particular nurse that keeps coming up, or not even if there's a particular nurse, do regular a health check, a mental health check for our nurses, for our midwives, because we know if nurses and midwives are happy in their positions and in their roles, then they'll give better care. And then let's go to the health facilities. I think I heard Professor Abayomi, our Commissioner of Health in Lagos State, say yesterday, hospitals are not actually built to function really well as hospitals. let's look at our hospitals. Our hospitals really set up to provide the best care. So I'm not knocking anybody, but do we have running water? Do we have liquid soap? And I know Island Maternity is an amazing exception, but not every hospital is like Island Maternity. I served in a primary healthcare center and they didn't have running water. The matron was using her money to buy running water. How do we expect them to honestly do the basics of washing your hands under running water? There's no running water. So our hospitals up to scratch. Because if the working environment is not right, you're going to have nurses and midwives and other healthcare professionals who are not happy. It's going to have a knock-on effect onto the patient. It's a domino effect. So it's not just a one size fits all. Everyone needs to be happy for the chain to work effectively. And then just going back to accountability, also part of improving a patient's outcome is if we notice that a woman is underweight, overweight, do we refer her to a dietitian? Do we follow on from that dietitian? If we notice that she comes in with anxiety, with depression, are we referring her on and following on? And I know Island Maternity is not really the example because they're a fantastic unit, but there are lots of other units that will say, it's not my concern. It is what it is. But that woman will then go on to either lose a lot of weight, it will affect her baby. Her baby will then have lifetime complications from what she was doing in that pregnancy. It doesn't just stop with the mother in pregnancy. We can't isolate the pregnancy. We need to think beyond. We need to think of the next generation and the generation after that in our measures, in the implications, in the things we actually do. Yeah, that's fine.
Yeah, thank you very much, Tolu, for that. Thank you. So I'll go to Dr. Ugo Okoli now. So Dr. Okoli, there's Nigeria Health Watch actually released an article on Tuesday where we spoke about how Lagos State is tackling the challenge of alternative birth methods right now, particularly talking about the coronavirus pandemic. We see, I spoke about the reduction in antenatal visits and immunizations due to the pandemic. So looking at the discussion of the minutes, looking at the post-COVID world, do you think we will still be able to achieve a Nigeria, a Lagos State, and a world where a woman does not die just because she's trying to give birth? Now we are talking about alternative birth methods. How does that all play? Would that make the case worse? Would that make the case better?
I think we just have to keep striving. We just have to keep working hard towards ensuring that every woman that comes in to deliver actually goes away at the end of the day with a live baby, and then she herself is alive. I think you want me to focus specifically on alternative traditional birth attendants here in terms of your article. Like I said before, I know Lagos State has a board that actually looks after these people. Not all of them will be registered with that board. But one thing we have to say to ourselves, we know, is that these people are there, they are existing, women use them, and women probably use them because of the money, but also because of the comfort that they actually have using these traditional birth attendants, because they feel like they are looked after and they are not scolded like they get in some places in the health facilities. So it's how do we ensure that these traditional birth attendants are doing what is right, are doing what is safe, and are able to understand when it is beyond them so that they can actually refer. And then also they know where to refer when it gets to that situation. And I must say, it's not birth attendants, they are also midwives or even community health workers that work in the normal health facilities, but on the side, they actually set up their own practices. And it's about how do we regulate all these services. And I know Lagos State actually has a board also called, an agency called HEFEMA, but I think HEFEMA actually focuses on the private and the public hospital, public healthcare facilities that we know. So we just have to keep striving. It's not going to change overnight, but we have to kind of keep working towards it and ensure that we are also embracing and regulating those that are not within the normal, I would say the normal system, to ensure that they are doing the right thing and that they are providing the right services and they know when it is beyond them to actually refer that woman.
Thank you, Dr. Okoli. Dr. Omololu?
Okay, still on the same topic.
Yes, yes.
Well, it's post-COVID is going to be a challenge because COVID itself was something we are not prepared for. And the biggest challenge that we still need to, we weren't even doing so well before in terms of reducing maternal mortality. And now we have this, virus to deal with. And we still have to do this, continue in that goal we're trying to achieve. So really, we still have to do a lot of the same things that we were doing before, but we just have to be more, more strategic in how we are doing it. It has been said that one of the ways to reduce maternal mortality is for a woman to have a skilled birth attendant with her, during the delivery. We also know that post-COVID, there's going to be an economic depression. I mean, that has been predicted, and it's something we have to prepare for. And when that type of thing happens, what you have is that women, because their husbands, may not be well empowered, or families may not have so much money, they start looking for where they can get cheap and available care. And that is going to be one of the challenges that we are going to have to face. Mr. Governor's free health for us the last 2 months has really helped a lot of women access good quality care at the general hospitals. But when that is no longer available or sustainable, what happens? Where do they go? What private hospitals are they going to? What TBAs are they going to? What mission homes are they going to? So the regulatory body of the state government needs to do more in terms of regulating the quality of services in all these places. And then the TBAs really need to be brought on board, so that the systems that we've been trying to do with these people before, with all these different health facilities, needs to be strengthened, so that way it's actually an opportunity for us to look deeper now and make sure that people can get the type of care that they need in pregnancy, because with the economic depression coming, it's going to be a bit trickier. IPC, infection prevention and control, we need to do more because we still need to stay safe, because the virus is going to be with us for a while, and there are implications. When women come for delivery in the hospitals and they come with their mothers, or many of them even still stay, their mothers come to stay with them after delivery. And we all know that, like, from what we are seeing with the COVID-19 pandemic, people who are elderly are the ones who are more at risk. So it's very important that a woman does not develop or does not contact the virus when she comes into the hospital. So infection prevention and control, social distancing, we still need to do a lot of that. Then risk assessment, we need to assess the risk of our patients, very, very critical, because that's what is going to make us give the men the right type of care they need. But whether we like it or not, the issue of spacing is going to continue because it's a social distancing measure. I'm sure WHO will be looking at the focused antenatal model again. So we need to, do proper risk assessment so that we are not missing out things from those who, need extra care. We continue to see them as frequently as we should, see them. I like what Tolu said about going about with your medical records, because that's going to be very, very crucial. I tried to show this last time. I don't know if it showed, but we had this in Lagos State. I'm not sure if we are still using it so much, but we need to bring it back. And it's basically a booklet whereby, pregnant women, all their history and everything is captured. All their scans and test results are all in here. So when they move from one place to another, all that information is not lost. So this needs to be expanded to even almost private healthcare facilities. And I even actually saw one of the TBAs. I gave a lecture to some TBAs sometime. They actually had something similar to this, which they give to their patients. So we need to do more and more of this in terms of better connectivity. And I think within every local government too, we need to have strong networks for referrals, because not every healthcare facility can provide all the services that are needed. So within the primary healthcare facilities, the secondary healthcare facilities, the private hospitals within each local government, there should be strong referral networks whereby, women can be sent to when they have challenges, when they have, challenges that come up in labor, or when they are identified as high-risk pregnancies, so that they can be moved to these places so that the, good quality of care can be maintained for them. So there's a lot of thinking we need to do, and we just have to make sure that we are providing this care with confidence, so whereby the patients and the staff have a lot of confidence despite the COVID-19 exposure. Sorry, talking about affordability, I think it's important to measure the Lagos State Health Insurance Scheme, which is ongoing. It also includes pregnancy care and delivery. So this is something people need to key into now very critically at this point in time, because it helps to make it very affordable for the women. So these are some measures I just think we need to look into. Thank you.
Yeah, thank you, Dr. Omololu. No school.
Yes, I can say it's possible. And as I'm still going to use my facility as a case study, because already before the COVID, we have what we call the forward to zero mortality on ground. That no woman or nobody, no pregnant woman should die. And if in case they die, there is this committee we call the NPDSR that will look into the cause and how to go about to prevent. It's a no blame, no name game committee that we look into. And this has really helped us in Lagos Island Maternity. And I'm still going to go forward that health education is the key. And all stakeholders are involved. It's a teamwork. Going into the community so that our women, pregnant women, can understand. They should be able to know the importance of accessing healthcare facility near them. And I want the government, if possible, to empower our women. Let them be independent so that they can decide for themselves post-COVID. Then we're still going back to, we are doing it in other maternity, the staggered appointment is still going to continue. And we're going to embrace the focus antenatal, at least maybe 4 visits per pregnancy per section. And again, if there is an high-risk patient, then that one can be looked into. Then family planning should be made very accessible. It's free in Lagos State, so that women too can access that, so that all these complications that may arise during pregnancy or delivery can be averted. Then also, we should be able to improve our facility. Let the government improve, let them equip, let them put the necessary things in place, and let them make health facility accessible. Most of the local government, the health centers are dying. Let them revitalize them, let them put them in place so that they can be able to attend to our pregnancy women. And referral, as my MD has said, is key. If you know you can't handle it, if you know that the case is beyond you, prompt referral is very, very important, because we see a lot of unbooked patients in Lagos Island Maternity. Once they get to us on time, definitely they will be able to save them. Thank you.
Thank you, Nosco. So we've come to the end of the panel discussions. I want to thank all our speakers, Dr. Okoli, Dr. Omalolu, Tolu, Adeleke, and Nosco Adebukola Oluwabusayo. We really appreciate you. And we have a lot of questions as expected. So can the panelists please go through the questions? So if you ask your questions in the chat box, can you please send them to the question and answer box like I explained at the beginning of this webinar? So I went through the chat and I saw a couple of questions, more than a couple actually. But we're going to be answering the questions from the Q&A box. And the first question is from Robert Yates. And the question is, are women and babies still being detained in hospitals in Nigeria because they can't pay their medical bills, especially after C-sections? If so, then might the COVID-19 crisis provide a good opportunity to pressurize politicians to ban hospital detentions and provide free healthcare for pregnant women and children? Thank you, Mr. Robert Yates. So I think that question was already given an answer by Mr. Yates. And so we'll just move to the next question. And for all the questions that we can answer during this Q&A session, because we all have to go back to work, we'll be sending the answers from the Q&A to all participants after the webinar. So from Blessing Tejumola, please, what type of delivery is advisable to a mother that had stillbirth at 40 weeks last year through placenta abruption? She is currently pregnant. I think I'll direct this question to Nurse Cole to just quickly, in 1 minute, give an answer to this.
An abruption pregnancy, she had an abruption last pregnancy. I still believe she can still go through a normal delivery.
Okay. Yeah, thank you. Next question. How can we leverage on the influence of culture and religion to promote health practices amongst pregnant women? I'll say, Dr. Okoli, can you give a quick answer to this? How can we leverage on the influence of culture and religion to promote health practices amongst pregnant women?
We can do a lot with that, like you've heard throughout the panel. And it's about actually engaging those religious leaders and heads of communities in different communities that have different cultures and religion to actually ensure that we're imparting the right information that they can actually impart through to the women through the locations or the venues where they meet these women. So for instance, in the churches, I would actually use my church as an example. You know, we do have occasions where we have health weeks, and we do it through what the Catholic Women Association. So all those women that register with the Catholic Women Association are able to actually gather the correct information through the doctors and nurses that are part of that group. And I'm sure we can do the same thing through mosques, you know, as long as we're imparting the right information to the leaders of those religious groups and so on. I think we talked a lot about that the first question that we had.
Yeah. Thank you, Dr. Okoli. So the next question, thank you so from Dr. Adore Aramide. Dr. Adore Aramide, thank you so much for this discussion. My question goes to Dr. Omololu. Now, with the COVID-19 pandemic, we have seen the way medicine is practiced globally, changed globally, especially with the use of telehealth. What role do you see telemedicine playing in the Nigerian healthcare system, especially in relation to maternal care post-COVID-19? Dr. Omololu?
Well, as I already mentioned, that without a doubt, telemedicine is going to increase in the way we practice medicine, especially maternal health, moving forward. We've already started adopting it in my hospital. I know I even saw one of my colleagues in his private hospital to also starting the teleconsultations. You understand? But I think it was Dr. Okoli that said it earlier on, or was it the other lady talking about Tolu? Talking about making information entertaining and sending to people, because this thing we call WhatsApp, that's where people get most of their information from, and people like the the storytelling. So we have to be innovative in finding ways to do that, and of course be structured at the same time, whereby people are actually getting good quality care. So this given information is going to come through technology. Health education, a lot of that has to go through technology. Apex School is doing a wonderful job with the online antenatal classes that we've already adopted. Where you talked, we already have the telephone lines where people could call in to have ask questions when they have challenges instead of coming all the way to the hospital. Electronic medical records, we have to start looking into that to a much more deeply. I know the Lagos State government was really on track for that before all this came to rock the boat for. But we hope we'll be able to pick up with that and continue with it. So without a doubt, the use of technology is going to play a big role moving forward, and everybody will just have to catch on one way or the other.
Thank you, Dr. Omololu. So Samuel Oyibo says, my question is to Tolu Adeleke. It is really nice you talked about holistic maternal care. The question is, what approach or strategy do you apply to handle maternal mental health care, especially postpartum maternal mental health?
Sorry. So what I do is I work really closely with a Nigerian, well, they're based in Lagos, Postpartum Support Network Africa. And anyone that, and this goes for men and women, so anyone who I feel might be experiencing, might have symptoms of postnatal depression or postpartum, the same as postpartum depression, or even depression or anxiety, or I find that they're struggling to cope, for lack of a better term, in the pregnancy, I refer them onto the Postpartum Support Network. Can you hear me?
Yes, we can.
Okay. So I refer them to the Postpartum Support Network. And if they cannot help, then they refer them on to other people. So for example, there's a lady who I've been seeing since she was about six weeks pregnant, and she has anxiety, she has depression. So even if they decline to be referred to her, then there are other things we can do. So we use, is it the Edinburgh? There's there are polls that we can use. Yes, Edinburgh Depression Scale, is that the one? Because I was also advised this by the Postpartum Support Network. There's scales that we can use to see her risk factor, and then it's for me to just try. You can't force anybody to be referred on, but if they agree to be referred on, then I do. If not, then I just keep talking to them through the pregnancy. So that's what I do, but I am independent of all hospitals. So that's my approach. And I don't know in Lagos if we can section anybody or because in London where I trained, we can call 999, the police will arrive and involuntary or section somebody, arrest somebody and section them. So I don't know if maybe Dr. Omololu can help me. I don't know if we can do that in Lagos. That's my approach.
No, we don't have that, so to speak. So basically, but we have to look at the overriding factor, which is that the woman needs to be catered for. Her safety and the safety of those around her is very paramount. So we do have to find a way to get her to the hospital where she can have the right care that she needs, the right specialist care that she would need if such a situation arises. But like rightly said, she may not want to go. We've had challenges of that. But in Africa, we have our ways. So we just have to coerce and cajole and, get necessary support people to get the woman. Sometimes they even have to deceive her, but it's all for the common good. So you have to get her to the hospital where she can be cared for.
Awesome. Thank you.
Thank you very much. So because of time, we've come to the end of the Q&A session. I want to say a big thank you to all our participants and all our panelists, of course, and also to MSD for Mothers for making this happen, for making the Giving Birth in Nigeria project happen. We are really grateful. And so for the questions that we could not answer, we can see all of them, we can see everything. And I can see some people are also asking for a recording to be sent to their email addresses. People are dropping their email addresses. We're going to send them to everyone who has attended this meeting because we have all your email addresses. We'll be sending the recordings and also your unanswered questions. We'll be sending them to the panelists as applicable and they'll be answering your questions afterwards. So at this point, a big thank you to everyone. And please see the link. There'll be a link posted in the chat box, leading you to where you can do a quick post-webinar survey. Just answer a few questions. Make sure you do that before you pop out. It's very important for us for our next survey, for our next webinar for you. And now I guess I'll just, as promised earlier, the answers to the maternal health in Nigeria trivia that was posted at the beginning of the webinar. So I'm just going to share my screen and post that, quickly talk about that. So the first question, Nigeria accounts for what share of global maternal deaths? For those who answered 19%, you were right. A joint report from WHO, UNICEF, World Bank and United Nations Population Fund estimates that Nigeria has approximately 58,000 maternal deaths, accounting for 19% globally. And the second question, what percentage of women in Nigeria give birth with a skilled attendant? For those who answered 43%, you were right. Assistance from a skilled birth attendant during delivery is a key factor in reducing maternal and neonatal mortality. And according to the NDHS survey of 2018, only 43% of women in Nigeria give birth with a skilled attendant. And the other 57% do not. And the third question, how many delays are associated with maternal mortality? I know a couple of our speakers, I know Dr. Okoli kind of referred to these to these delays while she was speaking. We have the 3 delays. The first one is the decision to access care right from your home. The second one, the identification and transport to a medical facility. And the last one, the receipt of adequate and appropriate treatment when you get to the health facilities. So thank you, everyone. I really appreciate your time. Thank you to the panelists and thank you to our participants. Please click on the link to the survey, which is there in the chat box for you to see. And then Thank you.